Diabetes can damage your body in a lot of different ways. Diabetes can attack your feet. This can lead to circulation problems, nerve damage, chronic sores on your feet, and worst case scenario, amputation. A common question that can come up when somebody knows that someone is dealing with diabetes and maybe does have some foot problems because of their diabetes is, why do diabetic patients overlook foot problems? Who am I? My name is Dr. Tarr. I'm a board certified podiatrist currently in practice here in Phoenix, Arizona, and I own a small practice called Direct Podiatry Arizona. So, as a podiatrist, I deal with a lot of diabetic patients treating the issues or complications from diabetes. I think this question has two answers, and people can fall into either camp. The first answer to this question, why it seems like maybe diabetic patients are overlooking or ignoring their foot problems, is maybe they're actually not overlooking. Maybe they just don't know how diabetes can impact or change their feet. For example, I had a patient just 2 days ago actually come to this office to see me, her and her grandson. She, about a year ago, was having issues with an ingrown toenail. She went to her primary care doctor, and the doctor said, "Hey, let's send you to a podiatrist because you are diabetic and you have something known as PAD, or peripheral arterial disease, which means that the blood vessels in your legs, specifically arteries that are responsible for bringing blood from your heart to your legs or feet, are diseased, damaged, or blocked." Now, when this happens, this will make it a lot harder for your legs and feet to receive the blood that they need, and that can lead to circulation problems. This also can lead to problems being able to heal any type of injuries to your feet or legs, and can increase your risk of amputation. So the primary care doctor, knowing all of this, said, "Hey, let me send you to a The podiatrist, unfortunately, performed a nail procedure on this person with diabetes and also with vessel disease. And she actually ended up with a below knee amputation because of this. It's a very heartbreaking story. So she came to me with complaints of an ingrown nail on the opposite side, the leg that she has left, and she wanted to look at non-surgical options to treat this ingrown toenail, which is something that I do here for certain patients. I'm shocked, but also I've heard it before, being a board certified podiatrist, that something seemingly small like an ingrown toenail can lead to amputation, especially if you're diabetic. And especially if you have a doctor that was too aggressive with treating you. One thing that she said that I will not forget is, "I wish I would have known. I wish I would have known that all these things can happen because of diabetes." So I don't think that a lot of times diabetic patients are ignoring their foot problems. I think it's just because, unfortunately, a lot of doctors aren't talking about this. Even podiatrists that deal with the complications of having diabetes and how it affects your feet daily, because we aren't having these conversations with our patients. Patients don't know that this can be a very real scenario, that the smallest cut, the smallest nick can lead to an amputation. That's part of the reason why I decided to get on YouTube to start making videos, because it's important that this information reaches as many people as possible. And if me making these videos can help prevent amputations just by empowering people and giving people the knowledge to take charge of their health, then it's well worth it. The second reason why it might seem like diabetics are just looking past any foot problems that they're having is, unfortunately, due to trauma or past experience. I've had a lot of diabetic patients over the years. Let's say they have a parent or grandparent that was diabetic, and then those family members went on to developing a chronic wound and then eventually amputation. That's a very hard thing to witness. Chronic health issues like that, usually when someone is dealing with wounds, you're in either a podiatrist's office, if it's a foot wound or a leg wound, or you're in a wound care center, usually every week. And wounds like that, especially if the patient is diabetic, if they have other health issues, they can take months if not a year or more to heal. So that constant being in the healthcare system can really wear on people, even if you are not personally experiencing that wound. The fact that you have a family member going through that process can be really hard. And then let's say they eventually end up with an amputation. That can also be really heartbreaking to watch, just like my patient that came 2 days ago with his grandmother. After her story of a below knee amputation, that can be traumatizing. There's been studies done, and I remember us reading about some of these studies in school, that there are a select group of people that would rather pass away with all of their body parts intact, even if that does mean passing away earlier than expected because of gangrene, because of infection, than to go through life with an amputation. Unless you have walked down that road personally, it's life altering to say the least what any amputation will do for you and change your life. And sometimes I've overheard other doctors kind of nullifying, oh, it's just a toe amputation. It's fine. It's not that big of a deal, but it's not your body part. It's easy to say when you're on the other side and that patient is laying there. But imagine if that was you. Imagine if that was your mom, your dad, your grandmother, your grandfather going through that. So, a lot of times, I think with diabetic patients, if they've had family members that were diabetic, or maybe themselves have had amputations before, they know, not to say 100% what's coming, but they know what seeing a doctor can look like for them when it comes to the weekly visits, more than likely, the wound care, the home health nurses coming to your home maybe to change the wounds. And they know, at least they have an understanding of what an amputation entails. So it's really fear based. I've had patients, let's say they have gangrene, for example, a toe is dying, and they will go to an appointment with their primary care doctor. They never take off their shoes to say, hey, this is what's going on. Maybe they have family members that live further away. They're not able to check on them, and they have an active case of gangrene going on. That's a surgical emergency at that point. Again, I think the second answer to this question, that it's a lot of fear that goes behind, hey, either I've been down this road before, or I've had a family member or friend go down this road, so I'm just going to tuck it away. Feet are kind of easy to hide in that regard until you can't anymore. Again, that's why I make these YouTube videos. Knowledge is power. If I can arm you with knowledge, then hopefully that will decrease your risk significantly, if not eliminate it from ever needing an amputation because of complications from diabetes to your feet. So again, those are my two answers about why diabetics seem like possibly they are looking past the issues going on with their feet. Leave a comment in the comment section down below. If you're diabetic, what type of foot problems have popped up for you, if any? Have you watched a loved one go through a chronic wound amputation? What was that experience like for you? Like, comment, and subscribe if you like this video today and would like to see more content from me. I will leave a link in the description box for my newsletter and my practice website, Direct Podiatry Arizona. Feel free to subscribe to my newsletter to get more weekly content from me in the form of blogs. And until next time, everyone, be well and take care.